Hello, my name is Dr. Shabbir Lehri, and in this video, we will try to master the art of developing MCQ solving approach. बहुत सारे नीट एस्पायरेंट्स के साथ ये होता है कि उनके 3 रिवीजन हो गए हैं, 4 रिवीजन हो गए हैं, 5 रिवीजन भी हो गए हैं, उनको सारी फैक्चुअल चीजें पता है, कॉन्सेप्ट्स भी अच्छे खासे पता है, बट स्टिल दे आर नॉट एबल टू सॉल्व एमसीक्यूज and they are not able to score well in grand tests. All they need is to improve their MCQ solving using this 5-step approach. Now, what exactly is this 5-step approach? First, what you have to do is read the last line of the question, then read all the options. Now you have a very fair idea that what exactly you have to search in the long clinical case question. So now you will read the complete question and you will focus on the points which will help you in solving that particular MCQ. Then you will try to rule out the options, and finally you will quickly go through all the key points again. For example, all of the following except, which is not a feature of, and so on. Now let us try to solve some MCQs using our 5-step approach, right? So this is a big clinical case question. What we will do, we will directly go to the last line. The clinical and lab results are indicative of which glycogen storage disease. तो हमको ऑलरेडी पता चल गया है that we are looking for a glycogen storage disease. We will go to the options: von Gerke disease, Anderson disease, McArdle disease, and Tarot disease. So now we will read the complete question, which is our step 3, and now we will look for specific points related to any of this glycogen storage disease. A 6-month-old is brought by his parents with a history of decreased weight gain. On examination, you will find that the baby has hepatosplenomegaly, muscle weakness and atrophy, hypotonia, and decreased GTR. Blood tests reveal normal glucose levels. Biopsy of the liver reveals initial stages of cirrhosis due to accumulation of abnormal glycogen with a few branch points whose structure resembles amylopectin. So this is a specific point which will guide us to our answer, that the answer for this question is Anderson disease. Now what I will do, I will move to step 5 and I will look if there are any except or not words given in the question which will change my answer, right? So there are no such words in this question and I can move to the next MCQ now. Okay, so now how to approach an image-based question? What you have to do, you have to look at the image just after your first step. So read the last line and then look at the image and then go to the next step, right? Okay, so which of the following nerves is most commonly injured in patient with this condition? So what you have to do, you have to look at the image and you have to find which nerve is most commonly injured. All right, so you can see that this is an X-ray of elbow, and you can very easily see this is the lower end of humerus, upper end of ulna, and there is a dislocation. So this is nothing but elbow dislocation. So if we look at the options: ulnar nerve, median nerve, radial nerve, axillary nerve, obviously not axillary nerve, right? So you will rule out some options. Axillary nerve won't reach up to the elbow, so it can't be the answer. And among these three, if you know the factual stuff, you will be able to answer that the answer is ulnar nerve. You can go through the whole question just to be safe. So X-ray of 20-year-old who came to the emergency after a fall on an outstretched hand appears as below. One word is missing here. On examination, crepitus is absent, the forearm appears shortened, and the 3-point bony relationship is disrupted. Which of the following nerves is most commonly injured? So you know that the answer is ulnar nerve, and you will go through the key points again. So which of the following nerves is most commonly injured, right? No except or no not here. So you can safely answer ulnar nerve for this question. Okay, so now try to solve this particular MCQ with me. Now coming to the last line, what is the most likely diagnosis? So this is not giving us much information, but at least we know that we have to find out the diagnosis. And now looking at the options: Kawasaki disease, rheumatic fever, Steven-Johnson syndrome, hand, foot and mouth disease. So we know that we are looking for a pediatric condition here. So let's go to the question now. A 3-year-old girl is brought to the emergency department with a 6-day history of high fever. Physical examination reveals bilateral non-purulent conjunctivitis. So we have conjunctivitis, red and swollen hands and feet, a diffuse maculopapular rash, and a strawberry tongue. So she also has a 2 centimeter enlarged tender lymph node on the left side of her neck. Lot of information pointing towards Kawasaki disease. but we will also try to rule out the other options. Rheumatic fever, it is not satisfying your Jones criteria. Steven Johnson syndrome, no exposure to any risk factor. Hand, foot, and mouth disease. So the rash given in the question is not typical to what is seen in hand, foot, and mouth disease. So I hope that this video was helpful. Try to solve more and more MCQs using this approach, and you will see that you will be able to solve such big case-based questions in just 40 to 50 seconds. Do subscribe my channel and do let me know your suggestions in the comments below. Thank you very much.